So my first piece of advice for an apprentice or a potential apprentice would be to use all of the information that's available on different websites, whether that's the National Apprenticeships website or NHS Careers. They can find out what the life of an apprentice is like, what their future career progression is likely to be like, and what the experience of studying and working at the same time would be. So to do all of their research and also consider the NHS values that we're looking for in our apprentices.
Well, I started my career as a trainee medical physicist, and since then I've developed a role within education and training, and now as the lead physicist for the National School of Healthcare Science. I've been involved in commissioning equipment in countries in Indonesia. My training enabled me to work for 8 years in France as a medical physicist, so it opens up a great many opportunities such as that. I'm now involved with writing curricula and training programs for national use. I'm involved with universities in developing their master's programs. It's an exceedingly diverse role.
So I'm specialising in radiotherapy physics, so I do a mixture of planning patients' treatments and looking after the machines and doing the QA and quality assurance on the machines. So for someone considering medical physics, I would really recommend trying to get into hospitals and departments to actually see what they're doing day to day, and then it looks really good for kind of job applications if you've got that there and they can see that you really are enthusiastic about it.
The advice I'd give to a young person considering music therapy as a career option is to go out and gain some experience, and that experience comes in many different forms. It doesn't necessarily just have to be within a music therapy context. One of the things I'd encourage people to do is go and look at the different settings in which music therapists work and perhaps volunteer or just go and find out, spend some time in those contexts, because that gives you a much fuller and broader picture of the types of work that music therapists do, because it's so varied. So that can be anything from going to spend some time in a day centre for adults with dementia through to being in a pupil referral unit for children who've been excluded from mainstream education. I'd also say enjoy your music, because your music is your tool, and that then becomes your clinical tool when you're working as a music therapist. And there's so much music out there, so it's about enjoying your own music, other people's music, and also music within other different cultures. There's so much to absorb that you can then transfer later in your career musically. I'd also say that it's quite tricky at times to gain music therapy experience because of the confidential nature of therapy. So it might be more about supporting a music therapy organisation, so giving them your time or lending them the skills that you do have that they can make the most of.
With regard to audiology, I think that would probably be the advice I would give somebody in a clinical role if they want to apply for a job within audiology, is to think about it not only as somebody who's wearing a hearing aid, but think a little bit broader, because audiology is not just about hearing, but also involves a lot of balance disorders, and it involves pediatrics or children as well as adults. So I think there's a wide range of different things that you can go into once you qualify as an audiologist. It's about thinking about what your passion is. Do you want to do just the assessment part of it? Do you want to do the rehab, which is basically once you have a patient as an audiologist, you'll be their clinician for the rest of that patient's life. So it's thinking about those few things and what you would like to do.